Hi, my name is Mary Jane Woods, and I'm here to present HNP number two. This is about a 42-year-old male who came in for a cardiac consultations that was referred by his primary care provider, PCP, because the patient has been having chest pain with activity and also chest discomfort at rest for a month. EKG was done at his PCP clinic a week ago, and it shows abnormal EKG or enlargement of the heart. So echocardiogram was done here at cardiology clinic, and it shows abnormal echocardiogram too, revealed a severe aortic valve stenosis that requires surgery. So patient was brought in back to talk about the abnormal echocardiogram and possibility of an open heart surgery that to replace his aortic valve. Patient doesn't have no medical history, denies any surgical history, and also patient has no known drug allergy or any allergy. With his medications, he's only taking Motrin, which is 200 milligram tablet as needed every 6 hours. With his social history, patient denies any smoking or never smoked tobacco. He drinks 1 or 2 glasses of wine per week. He exercises 3 times a week. He is married and no children. With his family history, he is the youngest of the 4 boys. His father is still alive, and his mother is deceased due to heart disease 5 years ago. To review of his system, we'll do the subjective first. His skin, hair, and nails, they're all absence of lesions and rashes. Lymph nodes, he doesn't have any enlarged lymph nodes or enlargement of the lymph nodes, and his absence of fractures or pain with his bone and joint muscles. He denies any headache or denial of visual loss or trauma with his head. With his nose, mouth, and throat, denies any discharges. His oral mucosa is moist. Absence of bleeding or any hemorrhagic or any bleeding or soreness or absent of hoarseness. With his neck, breast, and endocrine, he there's no swelling or stiffness, no jugular venous distension. With his respiratory, he denies any cough or any shortness of breath or any or presence of abnormal breath sounds like wheezes or crackles. With his vascular, he denies any palpitations or irregular heartbeat, but he does complain of chest pain and discomfort at his chest, with his chest. Um, Gastrointestinal denies any abdominal pain, any nausea, denies any nausea, vomiting, um, denies any heartburn. With his GU, denies hematuria, polyuria, oliguria, and also pain when urinating. Denies all of those. With his review of systems objectives, let's start with vital signs. His vital signs is normal except his blood pressure. He's a little bit hypertensive. His blood pressure is 154/99. But this is a 42-year-old male, and he's well nourished, well developed, and no acute distress with this assessment. With his HENT, which is the head, ears, eyes, nose, and throat, eyes are normal, no discharge, yes. Visual is intact. Ears are no protrusions or retractions. Nares is both patent. No discharge or any drainage on that with his nares too, and positive with gag reflex. Lymphatic. No sign of enlargement of or any signs of lymphadenopathy, no masses or no presence of focal masses, and also he has a positive carotid pulse. With his back, thorax, and lungs, his chest expansions are symmetry. Lung sounds are clear. You hear a good air movement with his lungs, and is absent of abnormal breath sounds, which is crackles, wheezes, and rails. Those are absent. With cardiovascular, he does have a crescendo crescendo descending systolic ejection murmur that radiate start from the second intercostal intercostal space that radiate to the right base of the neck, and also going to the left intercostal space and left of his chest, you hear the crescendo descendo systolic ejection murmur. Abdomen, with his abdomen, is soft, non-tender, denies any pain, and with his musculoskeletal, his range of motions are normal and absence of fractures. With his extremities, absence of edema and no signs of any cyanosis at all. And pulses are all about +2 throughout. With his mentations, he's alert, oriented ×3, very pleasant man. His cranial nerve from 2 to 12 are all intact. Denies any dizziness, fainting, or any headache at all. A headache. With his, he denies any anxiety or any depressions. But with this news that what we just told him, he's a little bit overwhelmed, but he does ask appropriate questions about his disease process. So with that said, we have assessment and plan is for differential diagnosis, of course, chest pain. Because of his abnormal EKG and abnormal echocardiogram, and it all both revealed enlargement of the heart and also severe aortic stenosis. The intervention and the plan for that is to have a referral to cardiothoracic surgeon for possible or soon replacement of aortic valve because of his severity of his valve disease. And with that said, too, the second plan is prior to surgery is to schedule a cardiac catheterization, and just to see if there's any blockages in the coronaries, and also to get an accurate number for aortic valve gradient, and also an accurate number for hemodynamic measurements. And second differential diagnosis is cardiomegaly. That's due to a severe aortic stenosis. So the plan for that was with the surgery, hopefully, it will fix the valve and the cardiomegaly will reverse back to normal. And also is to start him with beta blockers and also a hypertensive medicine. With I will start him with Coreg about 6.25 milligram PO Q day, and will continue. It will increase if needed, and will decrease if the dose, if the patient's, if the dose need to be decreased if it's needed. Also, patients' educations. Patients need to be educated about not doing his activity prior to surgery because of consequences or detrimental consequences with severe aortic stenosis. With that said too, after open heart, we will still continue to see the patients for a follow-up with his cardiac status and also his aortic valve, his cardiomegaly. And that's it. Thank you.